Girl, what are you doing? Here, baby. Whoa.
To me, that looks like that's going to be a disaster to get to heal.
Hey!
Tales Refuge is a full circle of life shelter founded in 2014. As a full circle of life shelter, we take in any horse, mule, donkey, or pony, no matter their age, size, breed, or training. Regardless of their background, we have never turned an animal in need away. Even after 10 years and over 1,100 animals that have come through our gates, you just never know what's going to happen. These are the horse rescue tales from the Tundra.
All right, next up we have Ducky, and Eliza over there has Daddy Tops. Daddy Tops and Ducky are off on their first trail ride at the shelter. Minor inconvenience. Those green gates over there were shut because of another minor inconvenience. So we're gonna go the other way and go up by the barn and then go around. All right, we are on the trail. So far, so good. So far, no spooks, just a little of hesitation when me and Ducky walked past the tape. For Ducky being blind on this side and is a little sensitive to it when it's being touched randomly, she's walking through these bushes like no tomorrow. That's actually not a big deal. Alright, instead of going up and around, me and Liza had to turn around because we forgot there's barbed wire there. Did not see it until we were like 20 feet away.
So me and Brooke are here picking up an owner surrender. We just arrived, so we're gonna see what she looks like and get her loaded. What do you think, Jules? It's good stuff, I promise.
Can I get a little hay, Carrie? Come on. Come on, walk up. Walk up.
You got it.
Come on.
Check it out. Come on, Jules.
Walk up. Come on.
Lots of smells. Good girl. You're okay. Very good. Kind of. Oh, very nice. Yeah, look. It doesn't eat horses. You're okay. You're okay. Come on, Jules. You can do it. Okay. Forward, please. Forward, please. All right, we are back at Ponytails and we're gonna get Miss Jules unloaded here. she wants to go backwards. Did you calm down some, honey? Hi. You're cute. You can turn. There you go, kid. Whoop, stop, honey. You're okay, babe. Yeah, you're okay. Friends. Yeah, that was a big one from Winky.
Not gonna like walking past him. He will start stuffing himself.
Good girl. They're just black mats. Very nice. Very nice. Hey, honey. Girl, what are you doing? Very nice. Very nice. See, look, you're touching it. You're touching it. Very good. You're okay, Jules. Very good girl. There you go, babe. So we had an adopter a while back adopt one of our horses, and unfortunately it did not end up working out. It was a little girl. She was absolutely devastated that it didn't work out with this horse she adopted. So they brought her back, and they have been on the hunt for another one for quite some time. They came out to meet Tree Star the other day, and she ended up being absolutely perfect for them. So today I am taking her halter and lead rope that the little girl gave me, and I'm gonna go get her, load her up, and take her to her new home.
Tree Star. 3, 2, 1.
Of course, to the horse.
Aw, perfect.
All right, Tree Star, we're here, honey. Yeah.
Back up.
What do you think, Tree Star? These are your new friends. They're excited.
Yeah. You're not coming out, mister. He's the naughty guy that... Look in your nose.
See you later, Tree Star. All right, Mr. Dan Patch is going to his new home today. Good kid, buddy. Very good. Come on. It's a new place, yeah.
Come on, big boy.
Good.
Come on, beauty.
Step down. Good.
Boy. Yeah, easy. Okay.
Very nice.
Come on, this way. Come on, this way. Step down, step up. Come on.
Very good. Wonderful.
Hi.
It's just me. Hey.
Easy.
Hey.
Come on, look. Come on. Got food? Got some food? I got some water?
You'll be all right, bud.
Got you.
So today we are going to be bringing Nadia into the barn. Kind of the same deal that we did with like Dan Patch and Sundance for a little bit. Well, Fergie is a good example. We're gonna put her in Fergie's old stall. So she still is able to go outside, but then she's also inside with her food. So she can get a bit more comfortable with what we do on the daily, us moving around. Yeah, and not being so nervous of us because we're harmless. So yeah, we'll see how this goes. Eliza's not really here. Come on, honey.
Oh, honey, no, we're not doing that right now. But thank you. I appreciate that. Why didn't I wear my mud coats today?
Good. She's a coming. Go over here so she hopefully doesn't see me right away. I don't know where she is. Hey, baby. Oh, she said no. Yeah. You're just gonna close the door. Calm. Good girl. So we just had 2 new owner surrenders arrive. One's name is Samuel and the other is Murphy. From the sounds of it, I'm not sure which one. One of them has heaves. The other one seems to be in good health, but they are both older and a bonded pair. So they brought him here together. They just arrived and we're gonna get them unloaded. You're right. He backed right out.
He might just turn around. Just turn around. Butters. Ow, that was my foot.
Hey. Hey, Samuel. And Murphy. Into the barn we go. You can make friends with Molly. And you can make friends with Nadia. Alright, so Mr. Jack here is getting on the trailer. I'm going to take him to his new home. It actually happens to be out where I live with one of our old workers. Some of you might remember Barn Renee. And actually, Papatia, if you guys remember her, she's actually boarded out there right now. So, couple PT friends. Good boy. Good boy.
That's not my hand. It smells like silage.
So I'll give them to you. Okay, 1, 2, 3.
I said, of course, to the horse.
Beautiful.
Arab?
I want to say we took x-rays too of her back, just so you can see angles if you want
Okay.
to.
Hey. You nice Arab? I saw some crazy Arabs today. Oh, she's got, her teeth have been done. Right at lumbar sacral she's sore. Maybe it's compensatory to those crappy back legs. All right. A good fortune. Good girl. Yeah, there's significant arthritis in her fetlocks.
We should have pictures of her
Which
fetlocks.
again, with this condition, that's what you expect.
Yeah.
It's going to be arthritic fetlocks. Felt good, teeth felt good. Those really aren't swollen. Eyes look clear, nose looks clear. Like I said, very mild wheezing in the lungs,
Okay.
but otherwise healthy, minus if you don't look at the back legs.
Right, yeah.
She would be a horse that I would say not even heavy trail riding.
Right,
probably.
no.
Because uneven surfaces are going to be hard, but she'd be good for younger kid arena work.
Okay. Some flat work.
Yeah.
Yeah.
Especially she seems to be a rock solid horse.
Yeah.
She handled me doing everything. And only thing she had was difficulty standing, but that's because she has crappy legs.
That makes sense.
All right.
Okay. So this is Winky. He's a recent owner return. He came back for some behavioral problems, and then he has a cut on his leg as well.
Huh. Did they have any treatment or history of treatment on the cut?
They did say that they took him into Stillwater the first day that they noticed the cut, and they got it stitched up.
Really hard spot to keep.
Yeah.
So much movement there.
Yeah, and then they returned him with this cream, this Equi-Aid cream, and they said that their vet had just instructed to pretty much keep it covered and that it should close up. It's not looking the greatest to me, and it seems super dry, and his leg is warm.
That's really swollen.
Yeah.
Its swelling is kind of going down the leg.
Yep.
Can you walk him for me? He's lame on that leg. Not horribly, but you watch him.
And I'd say he's almost moving a little better now than when he first came back.
You can just see he doesn't want to bend his stifle.
No. He's been on stall rest for about a week now, since he's been back.
Did they say how it happened?
They said they weren't sure. They just came out to the barn and found him.
There's a whole fence cut down below it, but that's probably old.
Yeah, that looks older and healed up. He is good about it being touched if you let him know you're coming, because he's blind on that side.
Eye.
Yeah.
All right, well, we'll end up there.
Yep.
We won't start there. So it just happened in the pasture,
Yeah.
or as you were told?
Yeah, and we didn't get any vet notes or medical records with it, unfortunately, to say what was all done.
Kind of curious if he's running any temp.
Yeah. Yeah, I've been worried about infection, but it doesn't look too
Well, to me,
bad.
it looks more like not infection, more like just a nasty, proud flesh granuloma that you have started there.
Yeah.
If you ask me, I don't know.
Like I said, it's really dry as well.
To me, that looks like that's going to be a disaster to get to heal.
Yeah.
Well, maybe we do skin graft. That'd be kind of cool. Boy, I can't get him above 97, so.
Hey, yeah, if he doesn't have one, he doesn't have one, I guess.
I didn't know if it does. Like you said, I don't know if it's infected. I just think it's a bad,
Icky.
it's going to be a bad granuloma and a bad spot to get to heal because there's so much mobility. Hi, bud. I'm right here.
I'm gonna mess with you a little bit. Yeah, you know what's coming. Oh,
Easy. Easy.
you're okay, Winky. Take another step and then you can't move.
Easy. Easy.
I know, buddy, it's ouchy. You're okay, you stepped on yourself. Good kid. Good kid. This is also like the most open I've left it, just so you could get a good look at it today. Usually it's pretty covered up.
My guess is that he that he did a good flap on it. Mm-hmm. Half the flap died. And this is what we have left, unless he just took a hunk out. Normally horses are better at making flaps that die than,
Yeah.
or maybe they just cut it off, I don't know.
Well, with them saying it had been stitched, it makes me wonder if it had died off and come apart a little.
I know what I'm wondering. If
Yeah.
there was a flap, those triangular flaps do not tend to survive well.
No.
Because it looked to me, it looks like it was a triangular flap that had like flapped open, and then they probably sewed it, and then it died and ripped apart. To me, it's not hot. He's not running a fever. I don't know if he needs any antibiotics. But I would. What have you been wrapping it with?
Well, they sent us with this, it's called Equi-Aid paste, so I've just been putting that over it, and then it forms kind of like a clay bandage.
Yeah, that's kind of like the Curacin clay or
Yeah.
something like that. It's another
Similar.
expensive horse product that's similar.
Yeah. I just, is
That's
that going to
swelling.
heal with something like that, though? Because to me, it seems like the skin's super dry once you put like the cream over top of it.
Yeah, because normally on these, I will if he'll let you. Once they become chronic and old, then I would you could do like a saran wrap bandage and keep it moist for like 12 hours. But generally I'd say put a wrap on in the morning and wrap on at night, keep it moist to promote healing, and then on for 12, off for 12 type thing. Kind of a sweat bandage, I guess is what I'd call it. You know, that's probably what I would do, partially to help get the swelling down too. The sweat bandages tend to take down because that thing's so swollen up.
Yeah.
Because that's what I would try, is alternate between 12 hours on a sweat bandage, 12 hours with the clay.
Okay. We can do that.
If you have, you know, people that are willing to do that.
Yeah, that's me.
Someone around here.
Yeah.
I guess that's what I would do with it, just because I think they heal better, you're right, when they say moist.
Yeah.
But I don't want it moist forever, because then they
No.
get infection, and you know, that's where you're kind of playing that half and half game.
Yeah. Find a happy medium with it.
Yeah, because often what I'll say is, you know, wrap it with a sweat bandage. Ideally cold hose it to get the swelling and clean off any, you know, debris on it. Basically, you're using water debridement. Mm-hmm. So you cold hose it, then you wrap it with a sweat bandage. Then you take the sweat bandage off 12 hours, whatever, 8 hours later if you're not here for 12.
Right.
Then you cold hose it again to basically take the sweat and the ick off of
Yep.
it. And then you put clay on it overnight, let it breathe, and then start the same process the next day.
Sounds good.
Chronic wound care, yay!
Sounds like it'll keep me busy.
Yeah. I have no other concerns. His heart and lungs sound good. Teeth feel good. He's blind in one eye, but we knew that.
Yeah.
He has a weird lump in the other
Yep.
foot, but nothing new other than a gnarly back leg.
Yeah.
And I think his stiffness might be just the amount of tissue that's there. Like,
I wouldn't want to move it too much with my leg.
yeah. And,
No.
you know, I guess I would try that for a while. I have a proud flesh case that I've had good luck with doing cryotherapy on, and so like liquid nitrogen, freezing it off when it gets really bad, and then follow up with laser treatments.
Okay.
It's an option. I'm not
Yeah.
saying to do that, but, and this isn't chronic enough, meaning it's not bulging out.
Right.
yet. So if we can prevent it from getting to that, hopefully we don't have to do that.
That'd be good.
We had a gray mare.
She was clean 10 minutes ago.
Yeah. I did wipe her feet off for you.
Oh, okay.
You're welcome.
Wee bit probably, but
Like her face
Does she have
color.
brown, or is she just gray?
She's just this color all over.
And you like to roll in the mud.
Yes.
Why does every light-colored horse like to roll in the mud?
I think it's a rule.
I have 2 white horses, and you should see them right now. You know spring chicken.
We have her about 19.
Yeah, that's about right. You told me 19 or 20, I wouldn't argue.
How old is she? Oh, she's 23? Oh, just kidding.
Looks.
23. Do we have her papers? I think we do. I think we do. Will you check?
Don't look that old, but I don't.
Yeah, go check Shelter Love, please. Thank
Got this
you.
little bump right here.
Yes.
It's like what do they call it? There's a term, hunter's bump.
Yeah, she was used as a broodmare for the last 7 years primarily. She is broke to ride. They had some concerns with arthritis, so we took a bunch of x-rays of her. We haven't noticed any like super lameness, but she's a little crackly.
Yeah.
So,
Hunter's bump, I don't know. That's just, to me, arthritis. It tells me there's discospondylosis. That's what a hunter's bump tells you.
well, you can see her back conditioning is not great.
You got a poor condition on your back. She's like, but I can still walk.
Yeah.
Boy, who trimmed her feet?
Yeah, good question. They haven't been done since she's been here, so the angles are not beautiful.
I say they look worse than when I trim feet. And that's not, I'm not bad, I'm not good at it. Can you lift this one? No.
Yes, you can. Thank you.
She does have some arthritis.
Like I said, we do have x-rays for you to review.
She's light colored, but I didn't see any melanomas anywhere on her, so.
None that we've noticed yet.
Back there, I didn't see any. Around her eyes, I don't see any.
His
Lips,
mouth.
underneath.
Good.
Mammillary looked good, so.
She's cute.
A little arthritis right there, but it's not very bad. Is that the calcification of a tendon or a chip? Honestly, for her age, she's not bad at all. I would say in her hocks there's some very mild early arthritis, and then there's, I think it's either a chip off the sesamoid or a calcification of it'd be the superficial suspensory ligament. That would be the only thing that I'd be noting, is that little calcification there.
On the right hand?
Yes, it would be her right hind. See this right here? To really tell the difference would be to do like a VD. You could see it then if it's off, a chip off of the little guitar picks, or it's just a calcification of the superficial suspensory ligament. Because the deep is not deep enough to be the deep. It's either superficial, unless it's mud, but I don't think it is.
I don't think it was muddy that day.
No.
So that's all I noticed. Otherwise, her X-rays look pretty good. I'd be more worried about her back than her back end.
Because she does seem kind of sore. Right?
I think it's her back though.
So Cairo maybe?
Yeah, well,
Absolutely no muscle.
she's got no muscling. She's got that like hunter bump on there. She's probably got significant discospondylosis, which Cairo can help a little, but not a lot. We're old. She's got moderate points. Older Belgian, you know her. Like I said, if you look at her, Ian.
She's been hard to get weight off.
Yeah,
I think we just had her at 20 plus.
easy. Really? These teeth. 24?
Yeah.
I don't know. I can hardly age those teeth.
yeah.
They're like tiny little things.
They're scraggly too.
Yeah. What is up with your front teeth? She crib on stuff?
Not since she's been here.
Those teeth are not. No.
She came from auction, so it's hard to say what her previous life was like.
Easy, easy. I don't know how she looks. Like those teeth are small enough; they almost look like she's more like 9 or 10. Because they're, you see how short they are?
They are really small.
They look like. Let me see if I can see the stars in the middle of them. Easy. Hey. Easy. Easy. They seem to be worn weirdly. They don't have circles. They're like, the stars are like elongated. Can you take a picture of these teeth for me? I want to. Here. This is her right, right? Yeah. This is what I wanted to see. It's basic. There's a lot of inflammation there. The corner again. What? Almost looks like she had either a bad injury there. See this like bump right here? Or is that just like almost ring bone? But it doesn't look ring bone because it should be on both sides. Huh. That's an old problem though. You got all that ossification. You know what I think this is? It almost seems to me like it's related to the white line, which is right here. It almost looks like it might be an infection, like a bad abscess that blew out the top. And it's festering right here. Because it's too low, it's like beyond, it's like right on top of the hook, because the hook really goes to right here. I don't know if this is like just an old infection or if it's what's causing her present problem. But this is the foot that has an issue, right? The right front? Yeah, because she wouldn't pick up her left.
Yeah.
Weird. I can see the problem. I just don't know what's caused it. To me, it looks like an old infection. It doesn't look related to a joint.
Okay.
So I would say probably a hoof abscess that has continued to fester and blew out the top. And that's what's creating this. You can see this really inflammatory right here at the top of the foot. And you can't see it because of all of her feathering. I wonder if you trimmed her feathering off the front of it and cleaned her up.
There might be something there.
You might be able to actually see where the wound or the draining track is or was.
Okay.
That's weird.
That'll be tomorrow's project then.
Yeah, grab her foot and trim
Yeah.
it up. At least it'd be just on the top of it. And it's right basically where the hoof wall meets the skin.
Okay.
Unless it's like really bad scratches that became an issue, but she doesn't look like it.
I was gonna say we
I don't
should be able to
feel
at least
scabs.
feel that.
Yeah.
Yeah.
I felt it. I could not feel it. That's why I would be curious to trim it and scrub it.
Okay.
Taylor, want to pull her up? She's another recent return. She just kind of moves like she's got navicular, if you ask me, but
You did take a peek at her the last time you were out here. She was that little sorrel quarter horse.
yeah, it had the camp brand on her.
I remember that. The right is worse than her left. I don't see anything in the navicular bone. Doesn't mean it doesn't have navicular. Like I said, it has to be like only like 20% can be seen navicular, but what I see is two things. So one, see this fluid? She has like bowed tendons, so like there's fluid in between her deep and superficial visual flexor tendon.
Okay.
See this right here?
Yep.
The other thing I see is there's inflammation here around her P2, P3 joint. Basically there's some arthritis. So probably low cartilage that is creating secondary arthritis. Which again could be a sign of navicular, meaning this is the joint that would be affected. But again, I don't see this navicular bone has no cyst, has no degeneration, has no obvious signs of navicular disease.
Should we do any different angles?
I don't know if you're going to see it. I can't see it in the skyline and I can't see it in the lateral.
Okay.
See, the left foot is a lot better, so you still have a little bit of inflammation between the deep, superficial and deep. I bet if you ultrasounded them. The only other thing to maybe do would be extend up the leg and to look at her sesamoids.
Look further out.
Just because I see this inflammation here, is this originating from the navicular? Or you could try doing peripheral blocks and see if you block the navicular and it fixes it, or you go up and you block the sesamoids and it fixes it, But I guess there's either two ways you do it. One is, since you have x-rays, so they're cheap
Get
for
the
you,
pictures first.
you shoot the pictures first.
Yep.
For a lot of people where x-rays have to pay for x-rays, you do the block and then you do less pictures because it's more expensive.
Right.
I don't think, if it was me, I would want pictures farther up to look at these sesamoids because I do see inflammation in the, suspensory ligaments, but that could be either here or sesamoids.
Okay.
And I don't see a problem with the navicular, at least obvious.
Alrighty.
This is Murphy, I believe.
Yeah.
He's said to have heaves. He just came in over the weekend.
I'm just watching him breathe here for a second. You want to walk down and back for me?
I believe him and his partner are both later 20s.
All right, walk back. He's got a heave line on him.
Yeah.
He's got rough lungs,
Yeah.
very wheezy.
Okay.
But his fetlock, this leg looks swollen.
I see that.
Boy, you can't really. Ouch. Hear that cracking?
Yeah. Is it just me or is he bowed over at his knees?
I think he is.
Like, quite a bit.
I'm just curious if he can how much he can bend them. Oh, actually, he can bend them pretty good. He does look bowed over, though, for sure. Looks like an old cowboy with bowed knees. But interesting, his flexion is normal.
Yeah. Wonder if it's just poor confirmation.
Yeah.
And then I did notice a spot in his eye as well.
Oh, that's just an old scar.
Didn't look too exciting, but I figured we'd note
He's a
it.
damaged cornea, or a scar in his cornea from a previous ulcer that's healed. He probably had a really bad ulcer some years back, but he got some pretty significant arthritis in his stifles. Hear him cracking from across the room. And his fetlocks are swollen. Again, my guess is probably just arthritis, or maybe it'd be, kind of rough, dude. Like 98. He's got some melanomas on his back tail and one on the lower part of his rectum.
All right.
All right.
Not in the best shape, dude. So this is Samuel, the one that came in with Murphy on Sunday. He was said to be otherwise healthy, a little on the thin side, obviously. But
He's mid-20s. He has loose teeth that need to get pulled.
oh, poor buddy.
I mean, as he's chewing, I can feel the teeth moving.
Done is all messed
This hind end is not good on him.
Okay, so it's this one. Oh,
Boy, but this horse, if it was outdoors this winter, it's going to go down and die because it can't get up. Just got no weight on it. And we don't have any, our back end is just not good. And I think a lot of that's just muscle wasting from lack of nutrition, whether it's, he can't absorb it, like that could be an option, and not saying they didn't feed him. Sometimes we're old, we're like mid to late 20s.
well, I guess the owner had said that they've only been together since like March or April, so not real long, but they tried to separate them at one point. And the one lost his shit, I'm assuming it's this one, and like was falling over and stuff, so I'm assuming.
Goodness.
I don't want this one outside in the winter.
Does he have teeth?
Oh, they're loose, but he has two teeth. Yeah, like I was feeling him and he was chewing, and you could feel him like moving when
Yeah.
he chewed. Like he has a half dozen teeth that maybe need to get pulled.
I watched your hand wiggle in there if that was...
What?
They're not helping him much.
No, they're probably hurting him because you're better off having no teeth than a loose tooth.
Right.
So I guess I would say there's one of two options. One, you get a bunch of dental work on him and see if that can save him, but it's rough for Wisconsin, and winters could be tomorrow.
Don't say that.
I saw snow on Halloween, all right?
Yeah. We had snow last Halloween.
Anyway.
Didn't get any here, so.
Do we do blood work on him maybe first?
We
Or-
could.
Or do we
my
just
gut-
think it's his teeth that's making
My
him
gut
look
tells
so...
me his blood work's going to be boring, but
His teeth.
Okay.
yeah.
Poor dude.
Righty.
Hey, Mondo. How's he doing personality-wise? Better since it's off? Or
A little
still-
bit.
He's definitely quieter, but.
Yeah. See, like, we couldn't do this before, so I guess I take back some of what I said. He's doing good.
Well, he was pretty reactive before,
Yeah.
which I think was partially because that thing hurt. Hey, I'm hoping he'd... Easy. You're okay. Would you let me touch your face here? Easy.
He was really good for cleaning the
I bet
drainage
I
and
bet he'd let me do it.
scrubbing it.
Shoot, I wonder, should we put him in the vet stock, you think? We could try it, I guess,
You
here.
want to now?
Good boy, Mondo.
I guess we can see how he does.
If I just distract you. Yeah,
Easy.
don't do that. At least you don't have an eye to poke.
Easy, dude.
Don't forget he's over there.
Hey, I'm just pulling him out.
Easy, Mondo. Hey, 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 hey. Go, boy. You're okay. Mondo, no. You're not doing that. That was dumb of you. Hey.
Hey, on. Pulls a little bit.
Yep,
Easy.
look at him. You're okay.
You're fine.
Good boy. Good boy, Mondo. Easy, Joe. Don't be sassy.
And we can put you in the vet stock. I kind of put extra sutures in here.
They did their job, though.
You didn't tear them open this time?
No. Bye, Mondo. That's goofy. Hey, hold your head still. No. Do not put me in that corner.
Easy, bud. Easy.
Mondo, you're fine. I'm still here. Hey.
So close.
Probably the worst ones left. Hey. Oh. Hey.
You can go to the vet's talk, maybe. Maybe we can
Let's do that. Hey! Mondo. I forgot you did that too.
I have like 2 stitches. I've never seen him do that.
He jumped out of his stall before.
I forgot about that.
Yeah. Again.
Hey,
Yeah.
Will you revisit the last 2 stitches or something?
Oh, we could. We could leave him there. He might rub them out on his own. They're untied. I just gotta get them out. You're okay. Mondo.
Quit. Good boy. I like some of that. Knock it off.
Maybe we revisit it, eh? Unless you want to get them out. I don't think it'll hurt them to stay in for another week. Or we drug them so no one gets hurt. Or I'm sure if you guys, you can see what needs to come out. It's that little strip right in the middle there. What? I think that you might need to snip that blue one. I forget if I snipped that one or not.
Don't.
But the white one is all cut. But you could snip it one more time in the middle to pull a little easier. But
I'll wait till he's calmed down again.
Yeah, because he was good for the first couple. Now he's just irritated.
he's all worked up
Yeah.
now.
So what did you want to explain the...
Yeah, so basically what it said is, honestly, the globe, so the eye itself, they said was relatively normal. But the carcinoma was primarily the third eyelid that was invading the corner of the eye. And it had necrosis, so infection in the center of it. So carcinomas, there's a chance of metastasis, but there's a good chance that it's curative by removal. So I have removed just the third eyelids of carcinomas. I've never seen one that big. Like that thing was massive.
Would you say you'd had it quite a while?
For it to expand to that, it's been 2 to 4 years, I'd say. Maybe less, I don't know. It depends on, it had a lot of mitotic figures, which tells me that it's growing fast. So it was a fast growing tumor, so maybe it was 1 to 2 years, but it was there. Didn't happen overnight, because I've removed third eyelids on a lot of horses where you get to start to see that bulge in the third eyelid. You sedate them, you cut the third eyelid out, and they do great. But this was like the third eyelid that had gone King Kong and made this huge ball of infection.
Do you think, like, moving forward, he's probably okay? Obviously, keep an eye on him, but...
Yeah, probably. You know, I always say when there's cancer involved, there's always a tiny risk of metastasize, but he doesn't look skinny, scrawny, like it's gone anywhere. I don't think he's crazy old either, so that's, I'd say, to his benefit. Okay. I would watch locally. If the mass regrows in that area, we know what it probably is. So that's what I would say. Now, I tried to be fairly aggressive and grab everything. That's why we took the eye, is because I could be more aggressive than trying to just snip around the eye and not damage it. And I probably had to take too much eyelid. You had to take the eye. There really wasn't a way around it to get the infection out. So, all right. Did call the university and I asked about BZ. Basically, what they thought is probably injury from foaling.
Okay.
So it'd be a foaling injury. They said possibly you could surgically correct it, but they wouldn't know without an exam.
Without her going in.
Yeah. The other thing they mentioned, and I would have to look up doses and what's available, but you can do like DES or estrogen type supplements that sometimes can help. I didn't price it or dose it out to see what we could get for her. Now I always worry because she's a huge horse that it could get pretty expensive, but I don't know. DES for like dogs is pretty inexpensive. So
like, what would it do to maybe help?
it-
Like, how would it keep the
it-
urine from getting in?
well, most of what it does is it helps tone up the uterus and the urethral sphincter.
Okay.
But that's where it's like, because when I asked about the pooling, they're like, well, it might keep her, if she's not fully closing the sphincter and is dribbling into it, it might prevent that. But if it's just when she goes to pee, it just all gets trapped in there, then it won't help with it. Does that make sense? So I don't know, does she have the patent sphincter? Well, so there's a sphincter there. But is she dribbling some, which is, exacerbating our problem? I don't really know. Because she's dribbling, but it could be just urine that's pooled in the uterus or in the vagina that is then sloshing out too from, she goes to pee and instead of it peeing out, it kind of pees back in. Does that make sense?
So what are your thoughts with her?
My thought is poor quality of life, and unless you were going to put a lot of money and go to a referral center that could possibly a surgical repair.
With a 20-plus-year-old.
Exactly. Like I said, you could try, even a Caslick, I don't know how that would really help, because you're just closing the top. It's not going to, if it was just that it was tilted back, but it's like there's a huge, maybe when it first started in a Caslick from the start might have made a difference, but there's so much inflammation, infection, extension in that vagina. I don't know. I talked to Dr. Schmidt too, just because he's a wealth of knowledge, and he's like, well, his first thought was Caslick too, but it's like, well, and again, you'd Hail Mary try it, but I just don't see it helping. It's just, to me, I think it's poor quality of life. Meaning you can get her feeling better, but she's not, as soon as you stop treating antibiotics and inflammation, infection, it's going to come right back because it's sitting in there. And so that was a thought, because the first question, like the university asked, well, has she ever had a fall? I'm like, yeah, I'm sure she's had probably 20. And I don't know, I guess if you have enough falls, accidents happen. Put a foot through the wrong place.
So we had a woman reach out regarding a horse that was going to be shipped to slaughter if the owner did not get the price of $350, which is what the kill buyer was offering. We ultimately paid the $350. The woman was able to arrange transport for the horse to get here. She is now at the safety of our shelter, and we'll have her evaluated as soon as we can.